Good morning, good afternoon, good evening to all. On behalf of the World Health Organization, the International Labour Organization and Monash University Accident Research Centre, it's my great honour to welcome you today to this international webinar series on Step Safely, the WHO technical package for preventing and managing falls across the life course. I'd like to begin by acknowledging the traditional owners of the land on which I meet with you today, the people of the Kulin Nation, and I pay my respects to their elders past, present and future. I recognise that I'm on the land of a nation that has had a relationship since time immemorial with this land. I extend my deepest respect to the histories and cultures of all First Nations peoples from across the world who are joining us today. My name's Jenny Oxley and I'll be your MC for this webinar. I'm the Acting Deputy Director of the Monash University Accident Research Centre, which we fondly know as MUARC. And I'm really delighted to open this second of 3 Step Safety webinars. And this webinar today will focus on preventing work-related falls. With no further ado into this introduction, I would now like to introduce Dr. Etienne Krug, Director, Department of Social Determinants of Health of the World Health Organization, based in Geneva, Switzerland, to give his warm welcome to today's session.
Dear colleagues and friends, welcome to this webinar series on fall prevention, which we at WHO are very happy to co-host with our friends at the Monash University Accident Research Centre in Australia. And the purpose of this webinar is really to discuss falls. Every year, more than 684,000 people die as a result of fall, and an estimated 172 million more are left with short or long-term disability. 2 shocking statistics representing huge amount of human suffering. About 37 million falls are severe enough to require medical attention each year, of course, adding a lot of cost, human and financial, to the health system all over the world. Falls result in more years lived with disability than transport, injury, poisoning, drowning, and burns combined. And of course, the vast majority of fall deaths and injuries occur in low and middle-income countries, adding to a lot of the other burden they're already facing. So falls are a growing and under-recognized public health issue. And many factors indicate that this issue is big today, but is likely to rise, including due to the aging populations as well as to increased urbanizations. The good news is we can prevent falls if we collaborate with individuals, communities, employers, institutions, healthcare professionals, etc., etc. A lot can be done to address falls, and that's what we have really summarized in the Step Safely WHO technical package, which is designed to support practitioners, policymakers, managers, researchers, and advocates to prevent falls. They're focused particularly on the 3 biggest at-risk groups: children and adolescents, workers, and older people. And this is why we have focused this webinar series on those 3 groups. We'll be focusing each of the 3 webinars in the series on one of the high-risk groups. So thanks so much for joining us. Please participate actively and above all, use the information gained to help us implement the Step Safely package in your country and in your region. Thank you so much.
Terrific. Well, thank you very much, Dr. Krug, for your introduction. I'd like now to invite Dr. David Mettings, who is the scientist leading the WHO Department for Management of Non-Communicable Diseases, Disability, Violence and Injury Prevention, and he's the executive editor of the Step Safety technical package. David, I'll hand over you to give your welcome to today.
Thanks very much, Jenny, and good morning, good afternoon, good evening, everyone. It's my great pleasure to welcome you all to the second webinar to support dissemination of the WHO technical package for preventing and managing falls across the life course step safely. As Etienne mentioned, today's webinar is going to focus on preventing falls in the workplace, which is one of the key sections and risk populations that are covered in the Step Safely package. I think today's webinar is it's especially rewarding for me because we've been able to collaborate with our colleagues in the International Labour Organization, or ILO, in developing today's webinar agenda and securing our excellent speakers. And we really look forward to our ongoing collaboration with the ILO on this issue. I hope that this is the beginning of an ongoing relationship to address falls in the workplace globally. Now, how big is the fall-related problem in occupational settings? It's really very, very large. There are an estimated 317 million people who suffer work-related injuries globally each year. And it is estimated that falls account for 12% of all occupational injury deaths. Now, the occupational activities that involve hazardous conditions, such as working at a height or on slippery, cluttered, unstable work surfaces, are those that increase the risk of falls in the workplace the most. The construction industry has, as you might expect, the highest rate of fatal falls in high-income countries, and fatal falls within those settings occurring from a height occur at over 7 times the rate of other industries in high-income settings. In high-income settings, the highest rates of reported non-fatal falls occur in the health sector and the wholesale and retail industries. So the burden of work-related falls in these organized workplace settings is really very, very high. Conversely, the burden of work-related falls in settings such as the household or within the informal industry sector is really very poorly documented and poorly understood, and that's particularly pertinent for low-income settings. Now, there are significant differences in the fall risks that people are exposed to within various industries and settings, and that should probably be relevant with, or be obvious from the quick overview that I've just given. And that really means that fall prevention interventions do, of course, need to be tailored to each work environment. Now, a hallmark approach to managing risk in these work environments is to conduct site-specific risk assessment and management audits. If one can eliminate hazards altogether in the workplace, that is advisable. So, for example, making sure workers are working at ground level wherever possible rather than from a height. And where hazard elimination is not possible, interventions that substitute or replace hazards with less dangerous options or separate people from hazards should be sought out. The role of introducing and implementing safe work policies plays a very critical role in fall prevention, with the enforcement of safety regulations a vital overarching lever for reducing occupational fall injuries. And the occupational safety and health sector has been rather well developed over the years. And I think within many countries, there are systems and structures in place. I hope we will hear about some of these today. That can serve as an entry point for further advancing this work-related safety dimension. There's no doubt that progress in this area will require both multi-sectoral and multi-level approaches, and this should include individuals who work to prevent falls, such as doctors, community nurses, and occupational health and safety practitioners, but it should also include those who help to facilitate fall prevention efforts, including individuals who are making political funding decisions, program managers, and fall prevention advocates. And when we developed the Step Safely technical package, we quite deliberately and explicitly targeted those two groups of individuals within the framing of the technical package. So we hope that it is relevant both for fall prevention practitioners, but also for those who can facilitate and support the work of fall prevention from a policy or a financial political support perspective. Now, a range of stakeholder groups may have an interest in reducing occupational falls, and it's important maybe that we just bear this very wide range in mind before we begin the webinar. It includes workers themselves, worker unions, families of fall victims, occupational health and safety organizations, health professionals, academics and researchers, private industry, and insurance companies. So I'm really looking forward to hearing more about preventing falls among workers from our experts during this session. And before I conclude, please allow me just to thank everybody who has been involved in the development of the Step Safely package, those who have prepared the current sessions, our great speakers, and all the individuals who have joined us today. Thank you very much for your commitment to fall prevention in the workplace.
Fabulous. Thank you, Dr. Mettings. That was a great introduction. Now, we were to have the Acting Director of MUARC to also welcome us. He's been called away, unfortunately, this afternoon. So I would like to take this opportunity to say a few words on his behalf. So on behalf of Associate Professor Stuart Newstead, I'd also like to extend a warm welcome from the Accident Research Centre at Monash University. We'd like to welcome all of the participants to this session. And it is the second in a series of 3 sessions focusing on the important issue of falls prevention in the workplace. Just a little bit about MUARC. We're based at Monash University in Melbourne, Australia. We've had about 35 years of history contributing to injury prevention, science and practice in Australia, our region and globally. Throughout this period, we've been a very proud WHO collaborating centre, and carrying this role is really central to our vision of ultimately seeing an injury-free society. While we still have some way to get to this point, it's important to incorporate good science and collaboration. And I think the work and activities within the collaborating centre addresses key injury challenges at both regional and global levels and fosters a collaborative global network to address these challenges. Indeed, we believe that collaboration is critical in achieving change through the sharing of knowledge and expertise. And through this series of webinars on falls prevention, we very much hope that we can accelerate success in falls-related injury prevention and see some real improvements in global health. As a university-based research, our primary goal is to provide the highest quality research evidence around injury prevention, but we don't stop there. It's equally important for us to align with the WHO as a collaborating centre to translate that those research outcomes into practice that will make a difference in the real world. And we think that the Step Safely technical package is a terrific example of collaboration having real world impact. And this series of webinars is an opportunity to share knowledge and expertise. And I hope that today's webinar will build on the excellent work of the Step Safely technical report. I'd like to thank Dr. Etienne Krug and Dr. Mettings for their opening remarks. I'd also like to extend a big thank you to Dr. Caroline Lukaszyk from the WHO Western Pacific region. Formerly, Dr. Lukaszyk has just recently travelled to join a position at WHO in Geneva. So congratulations, Caroline. But she's provided terrific support, leadership and collaboration with the MUARC team in getting this webinar series off the ground. And last but not least, I'd like to thank the speakers for today who are kindly volunteering their time today to present their work. I hope that for the participants today, this webinar will be of great value and really invigorate collaboration and the need to continue our efforts to reduce falls and falls-related injuries in the workplace. Okay, so that's the introduction from the Acting Director of MUARC. Now, the next session is to our panel speakers. We have 4 speakers today. But before we hear from our 4 speakers, I would just like to highlight a few housekeeping items. I encourage all participants of this webinar to introduce yourself via the chat function while being on mute for the duration of the presentations. And as we proceed with the presentations, please feel free to submit your questions via the Q&A function for our panel discussion later in this session. So without further ado, I'd like to introduce our first guest speaker, Dr. Yuka Ujita. Dr. Ujita is the Senior OS&H Specialist at the ILO, and she's based at the DWT-CO Bangkok. Dr. Yuka has a strong background and experience in the medical field as a certified occupational physician, and she offers OH&S services in various settings. In 2003, she joined the ILO Sub-Region Office for East Asia. Since then, she has contributed to the improvement and promotion of safety and health at work through policy and technical advice, knowledge management and capacity building, both at the headquarters and in field offices. The areas of her particular interests include OH&S data, protection of vulnerable groups of workers such as women, youth, migrants, and those in the informal economy. Dr. Yuka, I'd like to please present your presentation now.
Thank you very much, Jenny, for your very kind introduction. Good morning, good afternoon, and good evening to all. First of all, I like to thank WHO to organize this very important, very interesting series of webinar, and also inviting the ILO to be a part of this important webinar. So let me share my screen first. It's not the right one. So maybe let me try again. Good. So let me start my presentation. I don't know how many of you, the participants, know about aware of the ILO. But the ILO is already then Dr. Mettings introduced. We are working for World of Work, and actually the safety and health of workers, the workplace, is our mandate. We are work closely with the WHO, especially for the workers at the health unit. And so let me start. First of all, your safety and health when you're working is protected. Whatever you're working, your health and safety is protected by these are the list of the provision, the rights to safe and healthy working conditions, including the ILO constitutions or the Universal Declaration of Human Rights. And recently, the ILO adopted the Centenary Declaration for the Future of Work, 2019, and the safe and healthy working conditions are fundamental to decent work. And also we have a lot of international labor standards. In fact, so far we have 100, almost 90 active international labor conventions. And of those, about 40 of conventions is directly relating to the protection of safety and health of workers. The number 155 Occupational Safety and Health Convention is the one of the core convention, and especially for at the workplace level, it set out that employers are required to ensure the workplace should be without any risk to health. And what is the complete prevention measure of work-related injuries and disease? Already the Dr. Mettings mentioned about how many, what is how much is the impact of the work-related falls. But in fact, more than 2 million people die every year due to the work-related disease and injuries. And of those, of course, the fall is the very important the part of that kind of death, and also the non-fatal injuries and disease. And the principle to prevent such kind of incidents or the accident, the disease and the injuries is the risk assessment. Risk assessment is the very simple procedure, not rocket science. It's very easy to understand, easy to apply in all workplaces. Consists of the 5 simple steps to identify the hazards and identify who might be harmed and how, and then evaluate the risks. And based on the risks, the risk control measures should be planned and implemented. And always that control measures should be monitored and evaluated. And if the risk is not reduced or mitigated, again, another new control measure should be taken. So this is the steps. And then what is the hazards and risks at the workplace? Hazards are something with the potential to cause harm. Anything can be hazardous in your workplace, even though your workplace is usually the office, your office worker, and usually the office is not very harmful, but still in your workplace, you have the hazards. For example, water. Let's think about water. Water in the glass is not hazardous, but water in the big tank or the big pool can be hazardous. Or I'm sitting in Bangkok, and just 1 hour before, we have the strong storm, and it's raining. And working in the raining or the wet environment can be hazardous, especially you are working with electricity, right? And the risk is the probability of harm and the severity of harm. So you have to think about who will be exposed to the hazards is the individual factor, and also what will be the health or the safety outcome of the hazards. And when we talk about the fall itself is not a hazard or not a risk, but the fall is the incident or the accident. And we have to think about what kind of hazard will lead to the fall, and what is the risk associated with the fall, right? And these are the typical type of the hazards at work, not the necessary all, the cover all, but the very typical one is physical hazards, ergonomic hazards, biological hazards. We are still in the pandemic. Actually, the COVID-19 virus is the one of the biological hazard, chemical hazards, and psychosocial hazards. This is a very important one. And for the fall as incident or the accident, mainly the physical hazard can lead to the fall. Dr. Mettings says the working at height is the main reason of the fall, but also perhaps the ergonomic hazards, the human error, for example, is a source of the hazard, the fall. Or maybe the psychosocial hazard, if you are so stressed out and you cannot concentrate your work and the very destructive, maybe it's the source of the reason or the cause of the fall. And when you see the risk assessment, you have to map hazards in all workplace, in everyone. So all workers and all workplace, all work site, you have to map hazards to identify the hazards and evaluate the risk. So let's simulate the one very simple example. For example, I'm working in my office. These days still, we are in the mandatory teleworking. So I'm sitting in my house, my apartment, and working with my the desk and chair. And one day I'm doing something with the window. And then I see something, the dust on my the shelf. And I like to remove the dust. But this is my office. I don't have the ladder or something. So I think, okay, I use my chair to clean up my shelf. And you see, I have this kind of chair, mobile chair, and also I'm having the sandal or it's not the proper shoes, but the sandal. And then I successfully cleaning out my shelf. But what will happen? Very likely, I will fall and fall from the chair because it's mobile, it's not stable, and maybe injured. In this case, hazard will be office chair, but improper use of the chair. Office chair cannot be used for the working from height. And the risk is the probability of harm is likely. Maybe it's very harmful, and the severity of harm can be mild or possibly severe injury because I'm not young, I'm old, and I'm not very strong. So maybe I break my bone or maybe some severe injury. So that result, this instance, that work can be medium risk, level risk. And once you identify the hazards and evaluate the risk, you have to take the control measure. And the control measure should follow the hierarchy of control. Of course, the best way is to eliminate the hazards, to remove the hazards. Because by removing the hazards, everyone in your workplace can benefit. Or if you cannot eliminate the hazards, you have to substitute the hazards to the less hazardous material. And if you cannot substitute, the next step is the engineering control, isolate people from the hazards. And if it doesn't work, maybe next step is the change of the way of your work. And the last result can be the protective, personal protective equipment like mask or the helmet or the glove, etc. But when we talk about occupational safety and health, people say first the PPE, but PPE is the lowest hierarchy because it can protect only one person. So we have to start from the top level elimination. And what kind of, the ILO's approach we are taken, or what kind of tools we have. This is the global strategy on OSH. It was adopted in 2003. And there are only two main pillars. One is the promotion of preventative safety and health culture through this kind of webinar series or the conference training or just in a meeting to raise awareness on safety and health in your workplace. And the second pillar is the systems approach to OSH. This is in easier term, is the continuous improvement of safety and health using the OSH management system or improve the national or enterprise safety and health system. And we have to introduce OSH management system in each of the workplace based on the risk assessment. And what kind of measure we have in the ILO? That is basically international labor standards I already mentioned. And we have a lot of code of practices and guidelines. in line with the labor standards. And also we have a lot of training materials and information materials of research, data, and good practices. In case of the construction, that is the major industry, we have the lot of fall accident. We have the specific convention, safety and health in construction convention. And also we have the code of practice, and we have a lot of training materials. And one of them is the WISCON, Work Improvement for Small Construction Site, that is focused on the small scale construction site, including the informal economy workplaces. And my colleague Jen will talk about this WISCON later. So you can here listen to the actual concrete example of the WISCON activity. And if you are interested in the resources of the ILO, we have the very dedicated resource kit. So you can visit this website and you can get all the important, relevant information about safety and health in construction. And this is my last slide, a little bit about the WISCON. WISCON is the Participatory Action-Oriented Training Program, and it's very easy to understand, and the focus for the not OSH expert, but the workers, layperson on OSH, but the workers and the employers in the actual workplace, built on the local practice, using the learning by doing, and they focus on the low cost, no cost solution, focus on achievement, and we promote workers' engagement, involvement. And so this is my last slide. Thank you very much for attention, and I'm happy to answer to any question you have. Thank you very much. Back to you, Jen.
Fabulous. Thank you, Dr. Ujita. That was a great presentation. Our second speaker is Nasruddin bin Mat Ali from Malaysia. Nasruddin is the Director of the Construction Safety Division Organisation within the Department of Occupational Safety and Health in Malaysia. So I'd like to welcome Nasruddin, and I think he's already started sharing his screen. Terrific, thank you. Nasruddin, you're on mute. I'm sorry, Nasruddin.
Okay.
Thank you.
Okay, thank you, Jen, for introducing me. Again, my name is Nasruddin. I'm from Construction Safety Division, DOSH, Department of Occupational Safety and Health, Malaysia. So today I'm going to share about OSH in Malaysia in terms of promoting and engagement the industry partners. Okay, the topic that we are going to discuss today is more on promotion engagement, but again, I will explain a bit on the legislation and statistics, what's happening in Malaysia. So at the present, now we have OSHA, or Occupational Safety and Health Act 1994, and also Factories and National Act 1967. But in the future, we will have the OSHA Amendment 2002, which is already approved in the Parliament. And also, actually, this act is to support our occupational safety and health design and management, construction works regulation 2023. We hope next year, middle next year, and also the occupational safety and health work at height regulation. So this, I think, is very important regulation in Malaysia, especially. Why the first one, design and management construction work regulation? This is similar to CDM in UK, construction design and management, or DFS, design for safety or prevention to design, whatever. Yeah. So this regulation is very important because it will cover not only the duty of the contractor, but also goes to the designers and also the client. Yeah. So everybody have to play the rules. And also the scope also not only during the construction or post-construction, but also pre-construction phase. So I think this is a very important regulation that we are going to discuss today, and also the, in terms of working height regulation 2023, hopefully, yeah. So it's already in our the AGC, yeah. Okay. So this by looking at the statistics, of course the fall of person is the most frequent cases happen in Malaysia, I think, throughout the world. And the average of more than 30% of these cases involve fall of persons. So this is very sad. And in 2020, November data shows that it's more than 30% or 1/3 of the fall accidents happen due to the working height. Yeah. So from there we are going to we must do something, yeah, to promote safety and health in construction industry, to make sure that we can reduce the numbers of falls. Yeah. So in terms of promotion and engagement, actually in Malaysia we already have competency course trainings, for example, like for a site safety supervisor, a crane operator, and also a scaffold erectors. And then also we a lot of engagement. We engage the clients, the designers, the contractors, and also the other government agency. Yeah. And we also monitor the performance of a safety officer, site supervisor, contractor safety supervisor, and also the designated persons. So to do this promotion on the OSHIM, as I mentioned, OSHIM, Construction Management or Prevention to Design Concept, or CDM in UK. So we have a very good supporting from our minister, yeah, to launch this OSHIM guideline in Putrajaya in 2017. And then again, after that, in April 2017, we have handing over OSHIM guideline to the head of agency under Ministry of Works in KLCC during International Construction Weeks. And also after that, we engage the experts from the UK to look at our country and how to do this design for safety concept or OSHIM concept in Malaysia. And after that, in a year after, we call for the meetings. Captain of industry, all the heads from the construction industry, we come and discuss with the expert, Mr. Nick B from HSC UK, to discuss and see what can we do to implement OSHIM in Malaysia. And beside that, we do a lot of engagement, yeah, to make sure that everybody knows and everybody aware about this OSHIM concepts. So the most important is we engage with the client. This radar is real estate and housing developers association. We engage with them. We also engage with building industry presidential council, where all those presidents from the association and institution, we work together, look at the what can we do to improve this safety and health, especially working at height in the construction. And also we arrange a series of seminar and workshop, and we also engage the important persons, I mean the professionals, for example, like architect, engineers, and surveyors. And also we also want to involve the government or government-related company to involve in this package. And also we engage with the consultant, and for example, like Association of Consulting Architect and Association of Consulting Engineers. We engage them to make sure that they understand with our new regulation and with this OSHIM or Prevention to Design concept. And from there, we form a board of examiner, because later on we will have competent person, what we call OSHIM professional. Or in Singapore, they call it a DFS professional. Yeah, it's similar to Singapore also. And also after that, we launch a pilot project where these pilot projects involve with the government and also the private sectors to piloting this OSHIM concept in Malaysia. And as I mentioned, this National Council of OSH, this is the highest level OSH in Malaysia, also approved with OSHIM Professional Committee. And after that, we have a discussion and we form this what we call OSHIM professional committee members, which involve with the National Council of OSHIM and also the clients, the consultants, and also the professionals, the contractors, and also the training providers in our team, so that we can look at this course, look at the modules, and what should we teach to the professional, so that we can call them as OSHIM professional. And then after that, we have program appreciation programs with our Minister of Human Resource for this pilot project, and also OSHIM professional, and also OSHIM BOE just now. Yeah. So we have a very good event, and to get everybody supports on OSHIM concepts. And we also get a very good chance. We have with the IALI, or International Association of Labour Inspecting inspection. We discussed at Movenpick, where we have all the expert Kevin Mayer here and all the experts to discuss with us during what can we do with our OSHIM concept, meaning to say what the client can do to improve safety and health, what the designers can do, and also the contractor can do to improve safety and health in Malaysia. So from there, we do a lot of engagement. For example, like Public Work Department in Malaysia, we do a lot of seminar and give them a concept, because certain help sometimes if we can do earlier during the planning stage of the planning stage of the construction project, I think it would be very good for us to prevent during the construction and also post-construction, like maintenance works and so on, things like that. And then we from there we form a committee, and for example, like we have a design for maintainability and guideline access and egress to maintenance space. For example, if you want to climb, what are the proper stairs, what are the ladder, or what are the proper methods to do the maintenance. If we can design it earlier, that should be the best. Yeah. So we come up with this guideline. Yeah. And also we involve a lot of clients, big clients, for example, like Petronas Dagangan, the MRT, the utility company, electrical utility company, and with the association and everything. So in this program, our DG, the top management, and our Director General, and also the top management of the clients, we do the engagement, and then from there we form a committee, and we do create a workshop. What we call it is OSHIM workshop. We do the design this assessment. Yeah. To look at what can we do, what can the client do to improve the things, and also what can designer helps the designer, and also what the contractor can do to improve or to reduce the risk of, for example, working height and so on. So this workshop is really designed to tackle working height and acceleration issue, which is this is the critical problems in construction industry. And also we engage with the government-related company. For example, like our TNB, this is our electric utility company. Yeah, and we involve my DG, my Director General, and also top management from the company, to make sure that they can come up with the working and high and construction work permit initiative to make sure that everybody can follow. And then we have formed a committee, working committee, discuss with them and what can we do to improve in this GLC. And from there, we come up with our, for example, like this is the national working height guidelines. Yeah, this guideline to support our working height regulation, so that the client and maybe the contractors can follow what are the best method to prevent accident, actually working height. And then we also engage with the biggest GLC in Malaysia, Petronas, oil and gas company, to look at the working height. And then from there, we have this engagement program, and we come up with we engage with the contractor to be a mentor and mentee program. So that from there, Petronas, together with DOSH, to supervise, to make sure that the contractors are doing what we call it OSHIM concept, or prevention to design concept, to reduce the hazard, okay, in the construction industry. And also we engage with the association to come up with the training. So the association, Master Builders Malaysia, is the biggest construction association. They come up with guidelines for safe use of mobile elevator, working platform, and also the guideline for safe use of self-climbing perimeters protection screens. This is very famous now for tallest building to use this CPPS systems, so that they to avoid the risk of, to reduce the risk of falling from height. Yeah. And also we together, we are now in line contact with PASMA, the SS tower scaffold, and also we try to contact with this IRATA as a training provider to help us to come up with the guidelines. So we want the industry to come up with these guidelines so that because they are the expert to prevent working at high risk. Yeah. So, and also this session also provide a lot of training, for example, like temporary structure trainings, lifting training, and also this MEWT trainings to the industry. And also with them, we together, we work, do the seminar and workshop, to the countries. So, and also in Malaysia, we have our OSH Master Plan, 2021-25, and with the theme of OSH inclusive and unity and commitments. So from there, our PM every one of us needs to perform our respective responsibility and rules to ensure the success of this master plan, and in line with the theme of OSH inclusive, unity and commitment. We work together. So thank you very much. I think that's all from me. Back to you, Jenny.
Terrific. Thanks, Antik. Nasruddin, that was a really great overview of DOSH's activities and engagement in Malaysia. Thank you. Can I ask you please to stop sharing your screen, and then we can, that's okay, and then we can introduce our third speaker for today.
Okay.
Thank you very much. Thank you. I'd now like to introduce our third speaker, Jennylyn Aguinaldo. She's the project manager of the International Labour Organization. She's had more than 10 years experience in the development sector, implementing a number of projects related to micro, small and medium enterprises, the WASH in schools, public health and employment, intensive investments, such as water systems, construction and emergency employment. She joined the ILO in 2019 and managed the recently concluded improvement of water supply equipment management capacity for the establishment of peace in Mindanao, and that was known as the ILO Japan Water Project. She has also established 11 water systems in the conflict-sensitive Bangsamoro Autonomous Region in Muslim Mindanao, and implemented the community emergency employment COVID. That was a COVID-19 response to support workers in the informal economy. She also recently joined the ILO Child Labour Project in the BARMM as a project manager. So I'd like to welcome Jennylyn and ask her to commence her presentation. Thank you. Jennylyn, sorry to interrupt, you're on mute. Thank you.
Okay. Thank you so much. Okay, so good afternoon, good morning, and good evening to everyone here today. I am Jen Aguinaldo from the ILO, project manager of the improvement of water supply equipment management capacity for the establishment of peace in Mindanao in Southern Philippines. So today I will be sharing with you the project's experience in fall prevention and occupational safety and health in general at the community level, our successes and lessons learned in the implementation of community-based OSH in the work sites. So please allow me to start the presentation with a short background of the project and the Bangsamoro Autonomous Region in Muslim Mindanao, where the project was implemented. So as shared earlier, the ILO Japan Water Project or the improvement of water supply equipment management capacity for the establishment of peace in Mindanao in southern Philippines aimed at constructing at least 11 water systems using local resource-based approaches while providing local employment to the communities. This project, which was funded by the Japanese government and is part of the employment-intensive investment program of the ILO, engaged community contractors and local workers who were also the beneficiaries of the water systems. In BARM, or some of you might know the region, it's in the southern Philippines. Decades of conflicts in the region had put on hold development in BARM, making it one of the poorest in the Philippines, and it lags behind in most development indicators such as basic infrastructure, like water systems, health, education, and others. So the region, or BARM, is a relatively young government after it was born out of a recent peace agreement between the Philippine government and the Moro Islamic Liberation Front. As BARM is still in its transition phase, its ministries, such as the Ministry of Labor and Employment, are still developing its capacity. So based on the recent ILO Labor Administration study in BARM, it was found that MOLE, or the Ministry of Labor and Employment, has only one labor inspector covering the entire region for the implementation of occupational safety and health. So MOLE also has one of the smallest budgets in BARM, and only 1% of its budget is allocated for inspection, which includes OSH compliance. So just imagine the gap, between monitoring OSH compliance and the real ground activities. Fortunately, MOLE and its minister recognize their areas for improvement, and they are very much aware that businesses, establishments, construction firms, or employees and workers, especially the smaller ones, find it challenging to comply with the Philippine occupational safety and law requirements, occupational safety and health law requirements. Some are just even forced to comply, just submitting documentary requirements without really implementing OSH, and there really is no appreciation on the benefits of OSH. Thus, awareness on safety and health in the workplace in the region remains very low. So as our project is engaged in construction of water systems, we have work at height as we build water tanks. It is considered as a high-risk work. We partnered with the Ministry of Labor and Employment and proposed to them the following strategies. Because it's not possible for us to just construct the water systems without proper monitoring on OSH, and also as a labor organization, it is important for us that the safety and health of workers are secured, are ensured. So first, since as mentioned earlier, they only have one labor inspector, and in the ministry, they only have 5 staff who are trained on OSH. And the trainings that they have are only on basic occupational safety and health. And as the law requires, there should be safety officers who are trained on construction OSH. So that's why we provided them training. As a strategy, we provided them certification training for safety officers related to construction. And then we also gave them orientation on community-based approaches that was discussed earlier initially discussed by Yuka, one of the tools of the ILO. And then we rolled out the community-based OSH in the municipality where we had 3 sub-projects that were being implemented at the time. So luckily or fortunately, the Minister of MOLE was very open to the strategies that we proposed to him, and that's why we were able to implement community-based OSH in our work sites. However, we only have a few months left before the project closure. That's why we were only able to implement all of these in 4 months, starting September 2021 until December 2021. For the certification training of safety officers, we had 10 participants from the Ministry of Labor and Employment, because we feel that it is important that they have the basic knowledge of on construction, occupational safety and health, because they will be the one monitoring the compliance to the law. And then, of course, our implementing partners, because they're the ones supervising the construction work. And of course, the community contractors, which involves the workers and the designated safety officer in the water system construction sites. And then after they were given the certification training on construction OSH, we provided the MOLE, an orientation or a sort of a training of trainers on community-based approaches. So they were introduced to the participatory action-oriented training, which was shared earlier by Yuka, and also on WISCON, or work improvement at small construction sites. So, and then after, as an output of this training, we co-developed a training program that will be rolled out to the community. So after MODE was trained, we went to the communities or to the work sites where we had the water project, and we started rolling out the community-based OSH. The PAOT, or the Participatory Action-Oriented Training Program, was very simple. It started with a simple orientation on what to do in the course of the one-day training program. The training program can actually be adjusted depending on the available resources. When I mean resources, your time, availability of workers, and also the community contractors or the employers. And then after the very, very short orientation, they were given some time to do some action checklist exercise. They used a tool. As you can see on the screen, there is a WISCON tool which they used, and together they went around the different areas of the work sites to see or to assess what are the areas that need improvement and the areas where there are some good practices already that are being implemented. And after that, they go back to their small group, and then they do some discussions and present their findings to the plenary. And then after their assessment, they were given technical inputs on what should be done in those areas. And then after that, they again reviewed the list of their findings and tried to reprioritize which areas they need to focus on, because they cannot really address everything all at once. So they were made to ask to identify at least 3 areas for improvement. And then they did their group discussion and then presented it to the plenary. And then after that, they were asked to develop an action plan. And then after that, in the action plan, they were tasked to identify areas for improvement, what specific activities they will do, who will do it, the timeline, and the monitoring activities that they need to do to ensure implementation of the agreements. And then after a month, we went back to them to check on the improvements or the work improvements that they did in the work sites. So in the next slides, I'll be showing to you the improvements that they did in the work sites, but only those related to falls. So before, what you can see on the screen is the construction of an elevated tank. So there were some work at height, and initially they didn't have a good scaffolding. So their scaffolding had only, they didn't have guardrails, and the platform was not stable. And then after the rollout, they built guardrails to protect the workers from falling. Since their budget is limited, they made use of excess materials from work forms, and they also added some reminders or signs to remind the workers to be careful when working at height. So this is a low-cost intervention from them, from having no guardrails to having guardrails, and strengthening the platform or the base of the scaffolding. Before the rollout, they didn't use body harness, although they were trained how to use the body harness. It's just that I think when we gave them the training on how to use the harness, it was more of like a one-way instruction. So we just told them you need to use the harness to protect yourselves, but there was really no real appreciation at the time. But when they did the community-based OSH approaches, since it was them who identified that they need to wear harness when working at height, when we came back a month after, they were already starting using their body harness. And then this one, they used to just pile up their materials in the walkway. So anybody who might be running or who are not careful enough might trip off from the materials that were just scattered in the pathway. So using scrap materials and excess materials from their construction, they built this structure where they can place some of the woods, excess woods, or some of their materials to avoid obstruction in the pathways and avoid people from falling or tripping off. And as some of our workers are, and all, I mean, not just most, but all of our workers are from the community, sometimes their relatives, their children would come visit them. So since construction is a high risk activity, it's not really advisable for children to be playing around the construction site because they might fall in the area where concrete is being mixed or in the body of water near the construction of the tank. So when they realized that it can be dangerous for their children, they started building or they started putting barricades to avoid unauthorized people from going inside the work sites, and also putting some signs to remind people that only authorized people authorized workers are allowed in the work sites. They have also designated entrance and exit areas, not only for COVID, but also to avoid bumping into each other. And while they were oriented to do regular toolbox meeting where they discuss what they need to do for the day, or that was also a venue to remind them of occupational safety and health protocols, it was really not followed during the first few months of the construction. But they identified that it is important for them to have more regular toolbox meetings before before they do their work. So from once a month, they decided to do the toolbox meeting at least thrice a week. That's a good improvement to remind also the workers that, you know, we have to be more careful. We have to ensure that our safety and health are ensured, and that we are reminded of the protocols that we need to follow to ensure our safety and the safety and health of the workers on site. And these are the lessons that we have learned in the implementation of community-based OSH in our work sites. At the institutional level, it is important that the government understands the community-based approaches that we are doing. It's important to have their buy-in, otherwise it would have been very difficult for us to implement the community-based approaches to OSH. Because sometimes they might see it as contradicting the Oslo. I think it was helpful that the project framed the community-based approaches to OSH as something that is complementing the existing Philippine laws. So we also had a very understanding minister. He was actually first to admit that, yeah, we are not sure about the compliance to the Philippine OSH law because we only have one person doing all the inspections, and it's just not possible for him to be monitoring all of the establishments in the region. And we also learned that having full appreciation and completion of the entire process would require time, especially at the institutional level. The community identified the importance of establishing a community-based OSH committee. They were able to identify people who will be part of that committee. However, it was not formalized because of the time frame. But fortunately, even if it was not formalized, there was some sort of, they were still working, although not formally. There were some level of commitment to those persons who were identified to do the work. But it would have been better if all the structures were formalized. But there's one opportunity for the ILO actually to support the Ministry of Labor and Employment further, because the upcoming child labor project will also be working with the ministry to somehow institutionalize community-based OSH in the work sites where it's not yet feasible to comply with the national law. At the community level, we have learned that ensuring safety and health at work does not need to be expensive. As we've seen earlier, it can be low cost or no cost at all. And what's important is participation, no? Not only from the leaders, but also from the workers and from the community itself. Because as you may have noted earlier, some of these things were already provided to the workers. However, they don't follow because it's just a one-way. Initially, it was just a one-way instruction for them to use PPEs or to ensure that the place is clean, or to ensure that there are reminders or there are regular meetings. It's different when they themselves identify what needs to be done. So that's more sustainable. And it's important that, especially for small construction or small activities, construction activities, it is important to first focus on appreciation, that the communities will have appreciation of their safety and health in the workplace, because sometimes they can get too overwhelmed with too many things. So it's important that first they appreciate their safety and health at work, and to focus on simple and community identified improvements rather than just compliance. Because what usually happens is that when it's just for compliance, they would usually do some stuff like, okay, I'm just gonna get a signature from an engineer or from an OSH practitioner just so I can comply. But the actual practice of doing of practicing safety and health, the culture of safety and health is never practiced in the workplace. And lastly, it is important that follow-ups are done to ensure implementation of agreements and also sustainability. So that ends my presentation for this afternoon. Thank you, and good afternoon, good morning, and good evening, everyone.
That's great. Thank you so much, Jennylyn. And I think it's really important to really undertake those community-based programs, particularly looking at some of the challenges that we have in LMICs. So thank you for that. Before I introduce our last speaker, I just want to remind everybody that we have the Q&A and chat functions for you to please post any questions or comments so that we can try and incorporate them in the panel discussion that will follow the speaker presentations. Please feel free to pose any questions. That would be great. Okay, so I'd like to introduce our last speaker, Dr. Helen Brown. As an academic at Curtin University in Perth, Australia, Helen taught and conducted research in OH&S for over 20 years. And she was also the director of the WHO Collaborating Centre for Environmental Health Impact Assessment from 2014 to 2021. She's had extensive experience in the Western Pacific region, particularly working with the WHO, the Asian Development Bank, and both the private and public sectors. Helen's now working as an independent consultant and is particularly passionate about effective capacity building across occupational and environmental areas. One of her key areas of interest is the application of systems thinking to complex challenges such as organisational accidents and climate change adaptation. So with that, I invite you, Helen, to start sharing your screen and your presentation. Thanks. And Helen, you're on mute. Helen, do you need to go to slideshow?
Yes, sorry, unmute. I'm just trying to get my presentation up.
Yeah, slideshow is down the bottom towards the right. Right down the bottom of your screen. Yep, almost there. Next one.
Yes.
Towards right. Next one. Yep, that's it.
Great. Okay, thanks very much for the introduction. And thank you also to the other speakers for the really interesting presentations. I've been invited here today to speak primarily about Step Safely, which is, I guess, the star of the show, with a focus on workers. So at the beginning, David spoke about the workers being one of the three target groups of Step Safely. And so I guess we have to ask ourselves the obvious questions about why are workers a target group? And if we have a look at some of the statistics that are presented in Step Safely, there were 36,000 estimated deaths from occupational falls in 2017. And of course, I'm sure we can all appreciate that those deaths are just the tip of the iceberg. For every death, there's a lot more injuries and permanent disabilities. It's also important that we recognise that within the worker group, there are also really well-known what we call high-risk occupations. And these include construction, agriculture and forestry, and also settings such as healthcare, cleaning and retail. I'll just go to my next slide. Oh, sorry, I seem to have been, I've gone right to the end of the presentation, sorry. So I just wanted to talk a little bit about the life course approach that's been taken in Step Safely. We've heard that we have the children and adolescents and the older people, and I think it's important to remember that sometimes there's not this clear overlap between the three groups. So as we saw in Jennylyn's presentation, children and adolescents are often present in construction settings, and in fact they are often working in construction settings. And the greatest risk of injury in workplaces has shown to be the first 6 months of working. Then if we have a look at the number and percentage of older people in the workforce is also increasing, and this figure here is from Australia, but this data is indicative of really around the world, where there's going to be this significant increase, partly because of an ageing population, but also partly because people are needing to stay in the workforce for longer. And then, of course, we have to remember that workers are also not just workers. Workers also have responsibilities for these other groups, for children, for adolescents, and for older people. And obviously, a workplace fatality or injury, that worker is a daughter, a son, a parent, a partner, and often the main income earner for the family. So the knock-on effects can be really significant. In addition, if we have a look at the lifespan, of course, that working life takes up a really big proportion of our lifespan. And when we are at that working age, we tend to spend more time working than any other single activity. So obviously addressing falls in workers is absolutely critical. Another really, what I consider to be a highlight of the Step Safely program is that they are taking a systems approach. So we're not just looking at, one magical fix. They're recognizing that we have to look at safer people, safer environments, and safer policies and legislation. I'm just going to run through now the 4 key sections in Step Safely. So Step Safely has 4 sections, as I mentioned. Section 1 is what we call the main risk and protective factors, and this guides decisions on where to focus for prevention and management efforts. So I'll go back to, there's been reference before about risk and likelihood and consequences, or the severity of the impacts. And if we look at the construction industry, there's already been mentioned earlier about the very high consequences. So the high rate of fall fatalities and serious disabilities. We also have to look at other factors that might, play a role in how we treat the risk. So we've got mostly male workers, very high rate of immigrants working in the construction industry, and often temporary or casual workers. And there's also a high number of children, young people, unfortunately, including children working in the construction industry. But it's not just about things like fall from heights. I mentioned before that the healthcare sector is also high risk, but it's high risk for a different reason. Fatal falls in healthcare sector are very rare, so we're really talking about non-fatal falls, but those slips, trips and falls are very common, so the likelihood is high. And slips, trips and falls have been seen as really the most expensive worker injury in the health sector. And unlike the construction industry, it's more dominated by women than men. So all things we need to consider. Section 2 of Step Safely then moves on to what they call a situational assessment, obviously looking at the different workplace, and then the information from that helps to guide for prevention and management efforts. So as well as identifying the different types of falls, whether it's falls from heights or slips, trips and falls, we need to identify the different stakeholders and groups who would be involved in addressing these, look at the current efforts to address falls and identify potential resources, look at current policies and regulations, and then the resources that can be used to implement those things, and finally monitoring and evaluation. And I think a key point here is that of the 3 population groups, the current resources and policies and regulations are very strong in the worker sector. So I'll just give you a couple of examples here, and some of the other speakers have also given examples here. We obviously have general health and safety regulations, working at height regulations. We've got a range of international standards, national codes of practice, the ILO constitution, and resources have also been mentioned. But we also have industry or sector guidelines, government safety departments, a range of safety organisations. And so really in terms of the resources, there's just so much information out there about falls in the workplace setting. So that's a real strength. Section 3 of Step Safely moves on to interventions to prevent falls among workers. And the key points are going back to this systems approach where we're looking at safer people, safer environments, and safer policies and legislation. And the interventions in Step Safely have been divided into 2 key areas: in the workplace and in the policy making arena. And right throughout the technical package, they've used a simple star system based on the quality of evidence available, going from 1 star, which is prudent, up to the 4 stars of highly strongly recommended. And one of the things that I found very interesting in reading through the document is actually when we have a look at those interventions and the strength of interventions, I've divided them here just on a simple count into the older people group, which had 39 interventions, children and adolescents had 29 interventions, and the workers had only 11 interventions. And you can see there in that graph, they were either promising or prudent. So none were actually strongly recommended or recommended. So I think what that points to is even though we've got a huge range of resources to inform our management, we really have to look at the gaps in the high quality research in terms of workplace interventions in this area and compared to the other at-risk groups. Yuka also mentioned previously about the hierarchy of controls. And again, this is just demonstrating how we can really use the health and safety tools we already have. And Step Safely has this example of hierarchy of controls to prevent falls from heights. And of course, we can apply the same process to slips, trips, and falls. This is a quick snapshot from some of the recommendations in the worker section of Step Safely. And you can see here all of the recommendations shown here have the 1 star. So they are considered prudent, even though there might not be strong evidence in the literature yet to support them. And then they're divided into either people, environments, or policies. Another really useful aspect of Step Safely is the case studies. And in the worker section, there was a really good case study based in the US of hospital workers where a design of a best practice slips, trips and falls prevention was followed over a 10-year period. And that led to a 59% decline in slips, trips and falls. So again, just demonstrating what can be done with good management. I think that's also really pertinent, and actually it was also highlighted in Jennylyn's presentation, is that there's often an overlap of people and environments, whether it's are we talking about a workplace environment or a home environment. Those boundaries are becoming increasingly blurred. So if you are in a healthcare setting, the people in there, of course, can include healthcare workers, patients, residents, if it's a long-term setting, visitors or family. Obviously, people in a healthcare setting range across the entire life course. They could be able-bodied or disabled. And things like a residential and community care can be a workplace, but at the same time, a home for some people. So again, the systems approach is really useful. In the policy-making area, the interventions that were highlighted was obviously the enforcement of safety regulations is absolutely vital, and that more stringent workplace regulations are required in the construction industry. The use of economic incentives is really encouraged, and obviously things like functioning of health and safety systems such as legislation and workers' compensation. It was also pointed out in Step Safely that there can be significant inequities between high income and low middle income countries, especially the capacity for enforcement of regulations. The fourth and final section of Step Safely is essentially what happens after the fall occurs. This obviously requires good systems for the treatment and management of serious fall-related injuries, ranging from first responders, trauma systems, hospital care, rehabilitation, and of course, ideally return to work programs. One good example is the Op Health and Safety legislative requirements often require first aid training based on the level of risk, and some really basic first aid training such as airway repositioning and cervical spine stabilization can really save lives and prevent long-term disabilities. Another aspect highlighted in this section is that this is where informal workers can really be at greater risk here, because they can lack the support of things like rehabilitation and formal return to work programs. And so just in concluding, I hope that the presentation, and I think everyone else's presentations also, has highlighted that worker health and safety is really an essential part of public health. Workers are a large part of the population. And it's also important in progressing towards the Sustainable Development Goals, because obviously we need a healthy workforce for decent work and economic growth. And without that, it puts families at risk in terms of health and well-being for many years in some cases. So I'd just like to, again, applaud the team who have put this together. I think the life course and systems approaches in Step Safely can really deliver multiple benefits to the entire population. So thank you very much.
Great, thank you, Helen. That's a really good overview of the technical package. And I agree, I think a systems approach is really the way to go. It was really quite interesting that there was quite a lack of scientific evidence for this group. So we need a lot more of that evidence to back up some good programs. Okay, well, thank you again to all of our speakers. I think they've all been terrific and really presented some really great work that is going on, but also some of the gaps and challenges. So I'd now like to turn to our panel discussion session and introduce Dr. Ivanov, who will be our panel discussion facilitator. Dr. Ivan is a medical doctor from Bulgaria and a specialist in occupational health. He leads the global program on occupational health and workplace health at the WH headquarters in Geneva. So I'll hand it over to you, Ivan, to facilitate the discussion.
Thank you. Thank you very much. Good afternoon, good morning, good evening, everybody. Nice to be with you. And thanks a lot to the panelists for the excellent presentations highlighting the different aspects of prevention of slips, trips, and falls. I saw a lot of attention to construction industry, which is understandable from the presentation of Helen. Why is so much attention to construction industry? But also I was pleased to hear that other sectors are also covered, such as the healthcare sector, which is also a priority for WHO's work. In 2019, the heads of state of the whole world had a meeting, high-level meeting on universal health coverage at the United Nations General Assembly, in which they committed to a number of steps to take toward universal health coverage. Among these is to promote healthy and safe workplaces and to increase the access of workers to occupational health services. And in this context, I would like to ask all the panelists, how do you see the role of health services, particularly primary health services and trauma centers in the prevention and management of slips, trips, and falls? And particularly how also you see the challenges with regards to prevention of slips, trips, and falls in the informal sector, where there are less regulations, less inspections, and even less coverage with occupational health services. I would like to ask this question first to the ILO colleagues, Yuka and Jennylyn.
Thank you very much, Ivan. It's very important and interesting question and very relevant. And it's not easy to answer in a short time, but first of all, the approach to the informal economy workers, this is the big burden, big problem. And actually the ILO's working for the two dimensions. One is the policy level. Basically our the social partners, including the government, employers organization, and workers organization. At the same time, as my colleague Jennylyn presented, we approach directly to the grassroots workplace level. And the informal economy workers, including those in the migrant workers, is our another very important target. And actually the PAUT programs is focused on those the workers in the grassroots level. It's very difficult to cover by the inspection system or the national level occupational safety and health service. And the benefit of the PAUT is very easy to understand. Actually, it's no text and no instruction. The role of us, the OSH expert or the supervisor, is not to instruct or provide a lecture to the participant, but just to share the good example using the photos and illustration, no text. And also we try to find existing good practices to be shared with the peer workers or the next village, next community. So this is the very grassroots communication-based approach. And the informal economy workers appreciated this kind of approach because then they understand, okay, it's easy. I can do that also. And then they share the experience to the other people. So that is our approach. And also it works for the migrant workers, those who do not understand well the language in that country. And this PAUT approach is not only on construction. We have this PAUT approach in agriculture, domestic workers, waste management workers, the home-based workers, a lot of industries in the group of the workers. Right? Approach is the same, but the context are a little bit different. And that is our approach. And also, public health service is a key to implement this participatory approach. And as the WHO focus on the universal health coverage, the ILO focus on the universal coverage of the workers. But sometimes we have the difficulty to approach to the local workers. Then we try to collaborate, work together with the public health facilities, including the public health post in village level or the local level. And we work together with the public health nurses or the practitioners regarding the occupational health. Actually, occupational health is a part of a public health. So we work together and roll out the participatory approach. So this is the very much relevant, and we really hope, looking forward to working more and more with public health through the WHO. Thank you very much. Back to you.
Thank you very much, Yuka. Jennylyn, in your project on Wisconsin in the Philippines, did you have a collaboration with primary health care or public health services?
Yeah, thank you. Yes, actually, we have some collaboration with the rural health units of the Department of Health, or these are the rural health units in the Philippines. So they were actually part of the project. Because in construction, you are also required to have what do you call this? A training on I forgot, but they're still part of the training to ensure the health of the workers. So instead of us hiring a medical professional, because it's a very small scale construction, it's not feasible to hire a medical, because the law requires that for every X number of workers, you have to have at least one doctor, 2 nurses, etc. That was not possible in the project because the project is very short term and it's very small, and it's small scale. So what we did was we collaborated with the rural health units, and instead of getting a nurse, we requested the support of the health workers to also support the workers in the construction sites. At the same time, by doing that, they were also learning that ensuring the safety and health at the work site does not need to be expensive, because they were also part of the PAO training. So they are also learning from us that you don't need a doctor, a medical doctor. If it's not available, then what can you do? So they are also learning from the experience in the water project, and we are also benefiting from getting support from the rural health units.
Thank you very much, Jennylyn. And I would like to ask Nasruddin. He presented a very good experience from Malaysia about the construction industry. Probably in this construction industry also have occupational health services. And what do they do to prevent injuries among workers? Do they do any evaluation of the individual medical conditions of workers that make them fit or probably unfit to work at heights?
Yeah, thank you very much. In Malaysia, we have like, for example, like special tasks, for example, like the scaffolder, the crane operators, and they have to climb everything like that. So it's mandatory, it's a requirement for them to have approval from us, so that to get the approval as a competent person, so they must have undergone the health screening, to make sure that everything is they're okay, for them to work. And also we also have our special division, DOSH, to look into the health issue of the workers, and we also plan to do the enforcement and things like that, to make sure that they also take care of the health of the workers. Yeah.
Thank you very much. Helen, thanks a lot for your presentation on the Stay Safely report. How do you see the role of health services in preventing falls among workers? Workers, when they experience a fall at the workplace, that's considered an occupational injury, and they may be entitled also to compensation for that injury, but also collecting epidemiological information about the clusters of falls in different occupations and settings may be useful for taking measures. So how health services can support that? Are they capable of filling all the administrative forms for an occupational injury, and what's the role of the trauma centers?
Thanks, Ivan. Yeah, I think in terms of monitoring the number and types of incidents, the health services can play a really critical role. And you mentioned the burden of paperwork, which is often an issue. And I mean, I think we have to think about developing systems that don't become onerous, that aren't putting people off really collecting some quite simple data. And one of the reasons I think it's really critical, particularly with slips, trips and falls, is I think one of the challenges we have with slips, trips and falls is that the perception of risk is not necessarily high, because it's not dramatic. It's not like a fall from height. It's not like a death. So I think the more information we have, where we can go back to the workers and say, listen, this can really result, if we don't manage it properly, this can really result in long-term disability, a loss of income. The interventions aren't difficult. So I think one of the things that's lacking is having the data to change that perception of risk. And that's really where health services can play a key role.
Thank you very much, Helen. And there is one engineering question that was asked by our audience as well. If slips can be prevented by using floor materials that have substantive slip resistance over economically reasonable life cycle, why are the specifications based on ex-factory measures? And why do so many researchers make haphazard subjective evaluation of slip resistance rather than using reliable objective in situ measurements at sites where incidents have occurred? So basically, this is how we investigate incidents and how we find the root causes of incidents. Anybody in the panel who has an engineering background to comment on the slip resistance materials? Jenny, you would like to say something about that?
No, I unfortunately I'm not an engineer and I do not feel comfortable answering that question.
Okay, well, basically that points to the need to investigate every accident and look at the root cause of the accident in the specific circumstances. And it might be the floor that is wrong. It might be something in the system that is wrong. It might be something in the person that went wrong. Yuka would like to say something about this?
Yes, thank you very much. I think this is the very connected with what Helen said. Actually, the one of the issue is the reporting, notification system. In the workplace level, in many countries, even in the developed countries, this system, the reporting, recording system at workplace is not enough, not complete. And actually, the workers hesitate to report any accident, especially this kind of near miss or the light incidents, the slip tips and the fall is something like that. They don't think they need to report that kind of incident to the employer or the supervisor, but actually it should be. Then the employer and also the inspector can investigate and what is the root cause and make a prevention measure. It should be started from the reporting from the workers to the supervisor. There are a lot of factors, no system or the hesitancy because of their fear, the workers' fear, if we report the accident, maybe some negative employment status. So that kind of situation we have to change and improve and encourage the right way to report in the incident. Thank you.
Thank you very much. Are any other questions from the audience? I do not see more questions. Then I can turn back to Jenny for leading us toward the closure of this webinar.
Fabulous. Thank you, Ivan, and thank you to our speakers again and the panelists, and to our one or two questions from the audience. That was great. Okay, so yes, we are in our wrap-up session. Before closing, I would like to invite Professor Richard Franklin. He's the convener of the conference, and for him to say a few words to invite you to the upcoming WHO and Public Health Association of Australia World Safety Conference. So can I ask Richard to give us a bit of a plug for the upcoming conference?
Well, good afternoon, good morning, good evening, wherever anybody is around the world. It's really great to be here and great to be hearing about systems approach. It was great to take us on that journey through the evidence, thinking a little bit about policy. I really like the policy journey and that real challenge that we all have about getting policy from what we know should happen into actual action and then thinking about enforcement. And absolutely, I love the system stuff as well. And good to see we're delving into the root causes of some of these events that are occurring in the workplace space. So I'm Professor Richard Franklin. I'm from James Cook University in Townsville in the tropics in Australia, and I'm the convener of Safety 2022. This conference will be held in November in Adelaide, and we're very excited to ask you to join us to talk about some of these really important issues that you've just been talking about, but exploring the wider kind of injury area and thinking about where we're going. Obviously, in person, there will be a hybrid option for those that can't make it, but to get us together and to start thinking about where do we need to go post-COVID and the steps that kind of need to happen. We've been very excited to have over 600 abstracts for the conference and strong demand from the falls area, but also road safety, drowning, workplace health and safety as part of that kind of connection that we're doing. Also very much thinking about a policy, practice and research aspects as we put the conference together. We're also going to have a range of workshops. The workshops are going to be interactive, hands-on, that you'll get something out of as part of the process, and showcasing some of the delights that are Australia, from food to obviously Adelaide, and hopefully surrounds if you do come and visit us. The idea, as I said before the conference, is really to get us together to nut away at some of these really challenging concepts that we talk about. And again, I was really delighted to hear that people actually said there is a lack of evidence in the falls and workplace space. It's an area where I do a lot of work, particularly in agriculture, and we actually don't know what works. You know, we do use the Haddon's hierarchy of control. It's embedded in the Australian legislation around it. But I think one of the questions we've got to ask ourselves with these theoretical models that are embedded in legislation is, do they actually work? So, I mean, it kind of goes back to that parachute and randomized controlled trials, but we as a collective need to be thinking a little bit more about what does evidence look like and how do we know that something actually works. And this is part of what we're going to do. So we're thinking about the future. We're thinking about some of the big challenges that are coming out. So we've got issues around climate change. We've got issues around policy that are going to be discussed as part of the process, issues around finance and how do you actually finance the work that we do. So really interesting, again, going back to the work that's being done and funded around how we work in workplaces. But this is a wider kind of challenge for us across falls and the injury prevention space more generally. There are going to be some satellite things going on, not only workshops, but there'll be some other conferences, ability to get around the city. And for those that are a little bit research inclined, I'm running a writing retreat up in the hills in the weekend afterwards. So lots to do, lots of activity going on. There'll be Australiana dinner on one of the evenings. We're looking towards other activities, including launches of some products, hopefully the launch of the Australian injury prevention plan, but also most importantly, we're hoping that you'll get together, connect up with the people that you've been working with or seeing via Zoom, this little box that is in front of me that I see you all on, and welcome you to Australia. I really don't have much more to say than come along, contribute, be part of it. If you feel like you've missed out on an opportunity to do a workshop or you would like to put an abstract in, let me know. We'll see what we can do, obviously, as part of that process. And if you'd like to come on board as a supporter, we're always welcome for people that are wanting to do that. We do have some scholarships available for people to get to the conference, but otherwise it'll be great. Program for early career, program for those of us who've been around for a while, thinking about the research, thinking about the policy and practice elements of it. So thank you very much for having me. Well done to all the speakers. Really enjoyed it. Really love that we're focusing on falls in the workplace. I love it because I think it's such a challenging and complex area. And I think that was highlighted by the speakers, and well done to whoever picked the speakers. They're all great and really took us on that journey. So thank you very much, and back over to you.
Perfect. Thank you, Richard. And thanks for that plug. It's so exciting to be able to have an in-person conference and all of that networking. So I'm looking forward to attending. Okay, and I reiterate Richard's praise of our speakers. I think it was a really terrific session and you've shared so much knowledge and expertise that it's been really fantastic. So I guess, you know, today's webinar really aimed to highlight global regulatory and workplace approaches to falls in the workplace. And your presentations from ILO, both Dr. Yuka and Jennylyn, global and programs in the Philippines, Jennylyn especially, Malaysia and Australia, provided some really good examples of systems approaches, which are fabulous to prevent falls in the workplace. As Dr. Etienne Krug noted at the beginning of this webinar, this webinar highlighted that we can prevent falls if we collaborate, if we encourage you to implement the Step Safely technical package in your country, region and organisations. And we also welcome your further involvement in collaboration to help step safely translation into sustainable impact. Thank you again to our guest speakers for supporting our webinar, our organising team, to shine a spotlight on preventing work-related falls. And thank you to all our attendees for your participation and discussion. So we'll close this session, which was the second session of the webinars on Step Safely, and remind you that we're looking forward to seeing you all at our final webinar, which is next week, the 28th of April, addressing falls amongst adolescents and children. So good morning, good afternoon and good evening to you all, and thank you, and have a safe day, journey home, to work or whatever you're doing for the rest of your day. So thank you all and good evening.